All right, today's learning objectives. So we want to talk about the differences between influence and advocacy, but also how they interrelate. We want to work on specific strategies for influencing others and advocating for change. And then at the end of the webinar, you should be able to describe some examples of advocacy and influence in action in Alberta healthcare. All right. So like most of our previous webinars, we have information session for about half of it. Then we go into breakout rooms, which allows you to have discussions with your colleagues. And then we have a quick wrap up at the end. As I mentioned, it's now called the Physician Leadership Network, new name and look, available to all Alberta physicians, more focus on leadership, using the Leads in a Caring Environment structure. And Michelle Henne will talk about that a little bit more. And you'll see some new faces because we have expanded our pool of ACTT physician leads, or apples as we're now called. Okay, so today's topic, influence versus advocacy, distinguishing the difference. And I am pleased to introduce Michelle Henne, our fearless leader, certified executive coach, and certified lead specialist. Michelle, take it away.
Thank you, Janet. Well, welcome back, everybody. We hope everyone had a great summer, and welcome to all the new faces. We're really thrilled to see all of you and have you join our group. So as Janet mentioned, our sessions follow the CCHL Leads in a Caring Environment framework for leadership development in healthcare. And Leads is comprised of topics related to lead self, engage others, achieve results, develop coalitions, and systems transformations will relate to these topics in some way. And in our case today, the session on advocacy and influence is mainly related to developing coalitions, to building partnerships and navigating socio-political environments, but also to systems transformation and championing change, and also engaging others with effective communication. So it's a broad topic. And we have a fantastic panel today who are going to share their experiences and help to really illuminate the theory that we'll be discussing. And we have Amanda Brisebois, who has done a lot of work and study in this area and brings a wealth of information. And we're also very fortunate to have Trevor Day and Jordan LaRue with us, who also bring a lot of experience in the healthcare leadership world. So we'll hear from each of them at least a couple times as we go through. Okay, so a lot has changed in healthcare over the past 50 years, and the system is continuing to change very rapidly. And historically, physician advocacy has been related to patients primarily. The system was influenced by optimizing patients and general health promotion by physicians and other healthcare providers. But now, physicians are needing to advocate for themselves, for their teams, and even sometimes for society as a whole. So now physicians are advocating and influencing at the level of the system as well as locally. And once the job of physician was to take care of patients, and physicians were unquestionably the authority on that. But it's so much more now, and it's not nearly as black and white anymore. So the goal now is for physicians to shape system transformation through advocacy and influence. And this happens informally all the time with teams and peers. But for physicians to really guide system change, they need to have the ear and sometimes sit at tables with administrators and even politicians. Because if we don't have physicians willing and in positions to advocate and influence, system change will happen to physicians, and that will affect us all. We need physicians ready and able to advocate and influence at every level. So, Trevor is up first to talk to us a little bit more about that.
Hi, thanks, Michelle. And thanks everyone for joining us this evening. So yeah, as Michelle mentions, I'm here on behalf of the section of family medicine executive with the Alberta Medical Association, and definitely the work that I do with the AMA leans more towards the advocacy rather than influence part, which we'll talk about a little bit later in the presentation. I really like this quote from Winston Churchill: "Success is just going from failure to failure without losing your enthusiasm." I think it really encapsulates kind of three parts of being a physician leader and trying to work and also shape a system as it's changing in front of you. So, number one, failure is a feature and not a bug of leadership. Often we don't get what we want despite our efforts, and that's just like the sandbox that we play in, for better or for worse. Number two, leadership is very hard. As you can imagine, it takes quite a bit of effort to keep going from failure to failure without losing your enthusiasm. And then number three, that enthusiasm piece, I think, really speaks to having the correct mindset and approaching the situation that you have ahead of you, and being really intentional about how you present yourself as a leader. So we all know that the system is changing rapidly in front of us with the AHS reorganization and then also the MAPS initiative that Alberta Health is undertaking. As Michelle mentioned, these things are going to happen with or without us, and a lot of this is outside of our control because we do not have direct influence over the actions of Alberta Health. So our approach as leaders is largely focusing on that which we can control, while also doing our best to try and let go and mitigate the negative aspects of what we can't control. And we're all going to experience negative emotions as a consequence of the decisions that we cannot make, that other people make. And a lot of being a leader is how you mitigate those negative emotions and how you bring your best face forward to those meetings that you go to. Next slide. So this has been chatted about a lot before, and we just wanted to remind you about the growth versus the fixed mindset. So when you do face failure and challenges as a leader, it's really easy to fall into that fixed mindset where, I'll never figure this out. I might as well just give up. Alberta Health won't listen to us. They're just going to do what we want. Why even bother? And you just want to throw your hands up in the air, right? On the other hand, if you approach leadership and advocacy with a growth mindset, you can take those failures, you can learn from them, you can grow as a leader. You can ask yourself, is this my best work? You can realize that speed bumps and roadblocks are a normal part of the journey, and working around them or working through them is part of the normal development of a leader. And it also helps you continue to grow as a person as well. So it's not easy, and it is totally worth it.
Thanks, Trevor. Now we're going to call on Amanda to talk a little bit more about that.
I like all these quotes that are on my slide, so I'm going to just disclaimer, I didn't pick them, but I like this one. It's very important. You can't always get what you want. I've been in the healthcare system for 25 years now, all the way from when I started practice to really wanting to just take care of patients. And I hadn't had much experience in leadership. And I thought that really it was about advocacy, was about just saying, my patients need this. Why don't I have it? And as I've progressed in my leadership and gone to all the different levels of leadership across the province and country, I've really started to realize that it's very difficult to get what we want when you only see your perspective. And this is the whole thing about being in the fixed mindset. I talk a lot about getting out of this vortex in your brain of your own assumptions and your own narrative. So how do you get into that growth approach and not be stuck in the way that you're practicing every day? So it's very important that we look at other people's perspective and think about where they're coming to things at. And we'll talk a little bit about that and how that allows us then to advocate, because we're not only advocating for our own perspective, we're actually understanding what we're advocating for and who we're advocating for by integrating other perspectives. Next slide.
Thanks, Amanda. All right, so we've talked a little bit about advocacy and influence, and they are very interrelated, and it's actually pretty tough to really tease them apart. There's a lot of overlap and similarity, but there are also some nuances, so we'll try to go through those a bit. And as an example, the CanMed's role description of the health advocate talks about physicians contributing expertise and influence as they work with communities or patient populations to improve health. So if we try to define advocacy, there are many definitions out there, but most are along this line. Advocacy is the act of publicly supporting or recommending a particular cause or policy, often with a more direct and vocal approach. as opposed to influence, which is more about shaping others' perceptions, decisions, and actions subtly, often without direct authority. So you can influence without advocating, but it's difficult to advocate without at least some degree of influence. In fact, you can often get further with subtle influence than with aggressive advocacy. So we're going to talk a little bit about that with Jordan now.
Yeah, Jordan, with the PCN Leads executive, and that's part of the PCN governance structure. So our role would often land us as partners on bilateral and trilateral tables. So often with Alberta Health Services and Alberta Health. And as such, these are essentially grant funded positions, and certainly PCN governance structure is grant funded, and that kind of comes with certain boundaries because of the defined roles. And that means we typically get less involved in the advocacy or the large A advocacy at the very least, and that's kind of deemed outside of our role when we're sitting at those tables. However, when we continue to sit at those tables and continue to work collaboratively, we start to gain trust both ways and start to get to influence and inform our partners in ways that are aligned to our advocacy partners. In fact, after a year of sitting at the provincial table that was set up, and it had really been the first table to kind of have this tripartite kind of partnership with this kind of work in primary care, the first in Canada. So no one really ever done this before. So we were doing self-evaluation and reflecting together, which is an interesting thing to do cross-organizationally, right? And something that came up with everyone around the table was trust. And it's not like we actually achieved it there, but we were starting to achieve it. And that continued to evolve for years, actually. And as we continue to work with largely the same people, even a little bit of turnover, of course. But yeah, there's also been some times that where we know the advocacy has actually completely broken down, communication channels had completely shut off, and we still had to sit at our tables knowing that had happened. And that was very difficult. But at the same time, we did what we could to kind of leverage our relationships, leverage the trust in us to continue to send messages that as appropriate as we could to our partners, well, our colleagues, I guess, not partners, but sort of both. And it actually allowed both groups to kind of eventually see that there was a way forward at some point, even if it wasn't immediately apparent. So challenging, but necessary, I think.
Great, thanks, Jordan. And next we have Trevor back.
One useful framework as well as a leader is two things can be true at the same time. So going back to Jordan's example where he's sitting at his influence table while the previous communications have broken down. So, from Jordan's point of view, there can be this tenuous relationship that I'm feeling, and I can keep showing up trying to influence the people around the table. Or from sort of an AMA point of view, we can advocate fiercely for our stakeholders, and we can also continue to work on building our relationship and communication with Alberta Health. We can also be immensely frustrated with outcomes while also contributing to focus on only the aspects that we can control. So I think this two things can be true, which I actually got from a parenting book, is a really nice framework in terms of how to think about our role as leaders and how we're trying to shape the system. And it allows for shades of gray. And as we know, reality in life is full of shades of gray, and very rarely are things black and white. And so personally, I find this quite useful when I'm facing a difficult situation and not exactly sure how to proceed. I think, well, I can advocate for my stakeholders, and this other party can do what they think is right, and we can keep trying to move forward.
Great. Yeah, thanks, Trevor. All right, so let's move into talking a little bit about some strategies now. We've discussed advocacy can happen at many levels within a practice or hospital, in the community, and at the government level. And influence is used usually concurrently to reach the desired goal. Now, the first thing to think about is who. And there's a lot of who's here. Who are you advocating on behalf of is probably number one, and keeping in mind what's important to them. And then what organizations or individuals are involved? Could you partner with them and be stronger and more effective together? Who plays what roles and who influences who? Who makes decisions and what matters to them? And for instance, if it's the government, maybe you want to read the health mandate letter and understand how you can align with their goals in the language that you're using. So a lot of who's are important. And Amanda is coming back to speak to us a little bit about that.
You know, all of these quotes, they're so famous that are on here, and there's a reason that they're famous, because they're so true. And this whole thought about going fast alone, and we all hear, oh, we really want to win the race, and we think we're the most effective ourselves. So we get there and we go, go, go. But if you really want to go far, you go together. And I even go one step further. And my kids always say, but you can go fast and you can go far. And I think that really leads to how do we do that? And I remember when I was the medical director at the Grey Nuns, we had this great idea, we meaning a couple of us. And I think it was kind of my idea because I wanted something to be done. And we just put it through, and all of a sudden it turned into a disaster. And a bunch of people were saying, well, you didn't ask us. And this piece needs to go into place, and this piece goes into place. And right away I thought, oh, wow, it was such a huge learning lesson. We had to retract the whole thing and totally work over and actually start this process that we know so well now, is how do we actually listen to all the other people who are in the room and understand the perspectives, just like Michelle was talking about in these examples we're giving, so that you know who's sitting next to you, you know who's in the other group, what their perspectives are. And so you really understand each other. And that's when you really learn to go fast and far together, is by listening to all those different perspectives. So that's how we do it. And hopefully talking in your small groups too, you can talk about how you guys can start moving forward to really hear all those different perspectives and not just be a one, but be a group of ideas.
Thanks, Amanda. So the next thing we want to think about is the what and the why. So what are you advocating for specifically? What is the change that will make a positive difference? And what matters most to those you're advocating on behalf of? And then why is the change worthwhile? Why is it worth the effort? This is where credible evidence or need or benefit comes into play. And then finally, knowing who you're advocating for, what matters for them, who the decision makers and other players are, and what will speak to them. When you've got that, you can start crafting that compelling message, one that paves the path to solutions, not just highlights the issues, and then get that message out to those who need to hear it. So for example, that could be in a day-to-day conversation, just very informally. It could be at a committee table. It could be at a town hall or in a letter to an MLA, or even on social media, which is a big platform these days. And this is when we really start to get into the influence aspect of our advocacy and influence. And when I was looking into this, in the literary and advertising world, there are 3 strategies that are used to persuade readers or users. And the first is called logos, which is the appeal to the audience's sense of reason or logic. And so to use logos, we make clear, logical connections between ideas and include facts and statistics. And sometimes historical or literary analogies are used. Then with pathos, emotions are evoked using stories and relatable examples. So when we feel any emotion in relation to a concept, we're much more likely to pay attention, to remember, and to care. So think of those Tim Hortons commercials that come out at Christmas. Those are totally using pathos to get to us. And then finally, ethos is used to convey personal credibility and authority. So it's why celebrity endorsements are so powerful, and we all seem to be not immune to them. So we feel like we know them and we trust their opinions, and that's key. So that's why building relationships is so important to be successful in advocacy and especially in influence. So now, when you can use all 3 when crafting your message and approach, influence is definitely maximized. So Jordan, can you tell us a bit more?
Yeah. So at our tables, just because we were there all the time and working with each other for over years, you tend to get to know the partners across the table and your other organizations, and and it would come up, or you would actually end up sharing sometimes a bit about yourself, or they would share about themselves and certain anecdotes or of either successes or more often actually struggles in the healthcare system. And that happened on all sides. And it actually helped us to understand, why we were all sitting there together. It could actually, those events could mean something very important to each of us personally. That facilitated bridge building, and suddenly a bureaucrat across the table wasn't simply someone who I may have originally thought was someone who blindly followed orders from elected officials and little automatons, but they actually had a very deep interest, and maybe even more passionate than myself. I was taken aback, actually. Yeah, very deep interest in ensuring that they could discharge their duties while also doing their bit to ensure that, say, a disabled family member would receive equitable care in a community, and real gaps for someone who had cognitive impairment, would they have their care gaps closed, and it just made it very real. Those things could often be elevated and used to soften antagonism, reduce the othering that often happens cross organization, and it makes it a bit easier to see other points of view that can actually be valid, or maybe even based on wisdom, and also consequences that are very, very important, but have nothing to do with my little world. Even though I think of as a family doctor, I touch all parts of the system, and I'm so integrated and essential. There's a lot out there that has nothing to do with me. That's extremely important. So I learned a lot of how bureaucracy works through that. I learned some of the very good reasons why it can work in ways, even though at the surface I would have called it maybe frustrating and useless at first. But I come out a little bit wiser from that. Instead, I learned to rely on, say, my Alberta health partners to help navigate their world, where they would actually provide some of that how, and they would lean on ourselves to maybe use our expertise to craft the what. What are we going to be doing? So that was very interesting.
Thanks, Jordan. And back to Amanda.
I get back to some of the examples of how do you actually influence when you're advocating. And I think about the physician wellness piece that many of us are involved in. And you can talk about physician wellness and prevention of burnout a lot. And a lot of us are very enthusiastic about it. When you combine that with that logic and some of the data, and then the stories that come from it that Michelle's talking about, you actually start to see successes. And we've seen some of that in our own world. So I look at my own role. It was the physician advisor in the medical staff associations. When that first came up, I thought, wow, I can't even believe that's coming up and existing. It's expanded across the province now. People are starting to think these are important. And the PFSP is another example, same thing. I remember when it came in and I thought, oh, that's an interesting thing. I wonder if that's going to catch. They just got another huge $5 million grant. So these things, if you're passionate for things, you have backup for it, and you use the stories, you can really advocate for something that you feel is meaningful, other people feel is meaningful, but also then you can influence people that have things like money that they can give to you, or who can create a job or something like this that will actually get some of these things done. So those things together are really good to remember when you're thinking about it.
Right. Thanks, Amanda. All right, well, now it's time for all of you to talk with each other about, your experience of advocacy and influence. So we're going to move to breakout rooms.
Yeah, so these are the things that we'd like you to talk about in the breakout rooms, or at least their starting points. So, think about with social media, are you using platforms like Twitter or LinkedIn? And what approaches to posting are most likely to result in shifts in thinking and action? And how do you identify and harness partners in working towards shared goals? And then I'm sure we've all had challenging situations where our emotions got the best of us, perhaps. And were you successful that way? Or would you have been better off to keep it cool and calm? So, how can you regulate yourself in these high stakes situations when the negative emotions start to arise? So, those are starting points, but really you can talk about advocacy and influence in the breakout rooms. I am back.
Okay.
So does anyone have any aha moments they want to share from the room that they were in?
Yeah, I have one from our breakout room in room 4. It pertains primarily to the third question and how can you regulate yourself in high stakes situations when the negative emotions start to arise? There was really good conversation around having self-compassion and, realizing that yes, sometimes we do screw up and do regrettable things as all human beings do, and we can still learn and grow and love ourselves. And I think there were a lot of comments made about how self-compassion is not necessarily something that comes innate to physicians. And perhaps it's a skill that every individual physician should work on just, from an overall wellness point of view.
Great. Anyone else?
Joseph, I don't want to put you on the spot, but I know you had a very good comment as well regarding how to show up when things are difficult. Don't know if you want to share, but I think Joseph just kind of mentioned how important it is to look at intent when you go into certain situations. So what is my why? Why do I show up? And why am I willing to show up despite some of the challenges that I'm going to encounter? Despite some of the obstacles that I'm going to encounter, and how do I overcome those obstacles and grow as a person in the process as well? So it was very well stated.
Sorry, my daughter distracted me.
That's perfect. I paraphrased for you.
Okay, well, maybe we'll move on here and move to the close-up slides. So just wanted to mention that AMA Act has developed some PPIP support webinars. So we heard from physicians that they weren't sure how they were going to complete their PPIP. That's the Physician Practice Improvement Program, that you have to do 3 activities over the 5 years. One is a quality improvement, one is working through a standards of practice, and one is personal development. So these are some of the webinars that have been developed. And if you're interested in joining us and you haven't done one yet, refer to the AMA website and you can register there. All right, so our next session is October 29th and 30th. Oh, and just a reminder that tomorrow morning session is exactly the same. So please don't feel obligated to attend it unless you really want to hear it again, because Michelle was so great and the speakers were so awesome, but it is the same content. So the idea is that you either attend the evening session or the morning session, but not both. So October 29th and 30th, same. There'll be one that's evening and one that's early morning. And the topic is teamwork and effective team communication. We do send out summary emails, and I did want to thank everyone for attending.